Next medications that we consider are DPP4s. And to be honest, I have no idea what that stands for, but it doesn't really matter. There's 3 of them in the market right now. Januvia, these are all brand names. They don't have any generics yet. Januvia, there's Tradjenta, there's Onglyza. They all work about the same. They are less powerful. A1C is down about 0.6% on average. Often these are also combined with metformin to make medication regimens less complicated. They don't cause hypoglycemia. They are weight neutral, and they generally are well tolerated. Don't really have many side effects. They're just not that powerful. To be honest, I haven't really used DPPs fours that much in recent times, because if you're going to go with a brand name medication, you might as well go with something that's a little more powerful. But they are a reasonable and well tolerated option. What I really like a lot actually is this newer class called GLP-1s. And these work in the same pathway as the DPP4s, but are more effective. They are injections, so there is that part of it. But the good thing is the needle is actually very small. It's like more like this size. It's very tiny, and they're in these very convenient pens where people are able to give it to themselves either once a day or even once a week. And so the medicines in this class, the market leader right now is Victoza. I like it. It's a once-a-day medication. But there's also Bydureon, which I don't really like because it's very complicated to use. And a new one called Trulicity that is very elegant and is a once a week. The nice thing about GLP-1s is it's oftentimes the A1C drop is like 1.3 or so. 1.3. Which is the most powerful besides insulin. And there's also a weight loss typically. Oftentimes people have decreased appetites, and so they don't eat as much. Probably the most common side effect for GLP-1s is nausea and sometimes vomiting. But usually that goes away after the first month. A newer class of medications that's just coming out during the past 2 years is SGLT2 inhibitors. And this is kind of a newer type of medication. They're oral, which is convenient. They work by causing the kidneys to excrete the glucose instead of reabsorbing it into the bladder, where you just pee it out. And for these, they oftentimes they quote that I think they will cause you to pee out about 500 calories on average per day, which, if you can imagine patients eating 500 less calories, that can be significant. Oftentimes, A1C drops are around 0.9% in my experience, and also you can get weight loss. But sometimes you have an increase in their blood pressure and a slight increase in their lipid profile. But these are pretty easy things to fix. I have questions about the long-term risk of bladder cancer, and the jury is kind of still out about that. The last 3 medication classes have been pretty expensive. The drug companies are being very aggressive, and they're pretty much giving this stuff away, at least for the patient. So that's one other thing about it that's been helpful. The other helpful thing about it is it's a fairly powerful medication that for someone who is like a truck driver and is not allowed to be on insulin, then this might be a class of medication that can temporize things and help them to control their diabetes for long enough until they can retire or whatnot. Less commonly used medications, but are still worth knowing about, is cholestyramine. The brand name is called Welchol, and it's actually primarily a cholesterol medication, and it does a decent job lowering LDLs, but not as good as statins. But it also decreases your A1C about 0.4%, I believe, which is not terrible. Honestly, I never use it for diabetes, but it is kind of a nice little option there if you're running out of ideas. So these medications all work, and ultimately they are more of a means of buying you time until the patient frequently ends up on insulin. When used well, especially with diet and exercise, people can be stable on these medications for many, many years.